Hi, my name is Liz Raponi. I'm a dental hygienist with the Forsyth Teens program. And today we're going to look at illegal drugs and your mouth. So methamphetamines and heroin, and some other names you may hear are crystal meth, speed, ice, or crank. Meth mouth is also seen in heroin users, and this is a picture of what it would look like. This is caused by the use of smoking heroin or methamphetamines. They're highly acidic and they dissolve the outer layer of your teeth, the enamel off, and that's what you see right here. It's all decayed down here. The gums are eroded away. The bone level is not good. These teeth are loose. A dentist will not fix any of these teeth until they know the user is no longer using their drug of choice. It would be unethical for them to do that. They will, if a tooth hurts, they will extract it to get them out of pain, give them an antibiotic if they have an abscess or an infection, but that's really all that they can do until this person stops using their drug of choice. So, meth effects on your mouth, and this is similar to heroin also. So, rampant carie progression, meth mouth, is what we just saw in that picture. It also causes xerostoma or dry mouth. Methamphetamines and heroin decrease the amount of saliva produced, and saliva helps protect the teeth from acids. There's cravings for sugary, high-calorie, carbonated drinks, and we all know soda is not good for our teeth. Increases decay rate. Heroin users tend to snack more, and they're not snacking on healthy snacks. So what they're snacking on will increase their risk of dental caries. The acidic nature of meth and heroin also adds to the increase in decay, mostly affecting the smooth outside surfaces of the teeth. So, cocaine or crack cocaine. When it is inhaled through the nose, the cocaine gets up into the nose, and gravity says that powder will go into the sinuses. So when you look at this picture right here, this is the roof of somebody's mouth, and then you're looking into their sinus through that hole. So heavy cocaine users over time may get this perforation in their palate. Cocaine's acidic, and so when you inhale it through your nose and it gets into your sinuses, over time it will dissolve the tissue and the bone and cause this perforation. It doesn't hurt. It can be corrected, but a doctor will not correct it unless they know the person is no longer using cocaine. And it's the same here. There's a hole in the nasal septum, but in between both sides of the nose. Cocaine rubbed on the gums will cause gingival recession, and that's what you see here. This area right here should be all pink like the rest of this. So there's bone missing and there's also gum missing. And then I found this advertisement from the late 1800s. It's cocaine tooth drops. They used to use it for children who had toothaches. And they took that off the market as soon as they realized it was addicting. Effects on mouth and upper respiratory system. So your upper respiratory system is your lungs. So snorting cocaine damages the inside of your nose and sinus cavity. Cocaine is acidic and abrasive, so it can wear or cause perforations or holes in the nasal septum and the floor of the sinus cavity. It also causes irritation to the lungs, increasing risk of infection and permanent damage. Rubbed on the gums, cocaine causes lesions or sores and wear on the teeth and gums. Again, it is acidic, so it increases the risk of decay. Cocaine use can cause grinding of the teeth, which damages the temporomandibular joint, and that's your jaw joint. And over time, if it's not corrected, it can cause arthritis later on in life or problems with your jaw opening and closing. And like almost all illegal drugs, xerostomia is also additional effect, and it does increase the decay rate. All right, this is marijuana, weed, cannabis. And if you look at this picture here, this white area is considered a precancerous lesion. It's called leukoplakia. I know that this unit is on illegal drugs, and for under 21, marijuana is still illegal. You're not allowed to buy it. Effects of marijuana on your mouth. Fiery red gingivitis, which means your gums are bright red. They'll be tender, sore, possibly bleeding. Gingival leukoplakia, that's a white spot on your gums, is typically looked at as precancerous, especially if it's not gone within 2 weeks. Alveolar bone loss is the supporting bone that hold the teeth in the jaws, and heavy marijuana smokers sometimes have a problem with that bone being resorbed or dissolved. Gingival hyperplasia is just excess gum tissue. Oral papilloma is like a wart on your tongue, mouth, and really anywhere in your oral cavity. Uvulitis. The uvula is that little thing in the back of your throat that looks like a punching bag. Some marijuana users have a problem with that swelling. Increased risk of oral and lung cancer, and xerostomia, which is dry mouth, and that will help increase decay. Smoke from marijuana has been shown to contain many of the same toxins, irritants, and carcinogens as tobacco smoke. Beyond just what's in the smoke alone, marijuana is typically smoked differently than tobacco. Marijuana smokers tend to inhale more deeply and hold their breath longer than cigarette smokers, which leads to a greater exposure per breath to tar. Smoking marijuana can harm more than just the lungs and respiratory system. It can also affect the immune system and the body's ability to fight diseases, especially for those whose immune systems are already weakened with immunosuppressant drugs or diseases. So an example of an immunosuppressant drug is a steroid, and a disease would be lupus. When marijuana use begins in the teen years, it can have a significant impact on brain development, including decreased brain activity, fewer neural fibers in certain areas, and a smaller than average hippocampus, which controls the learning and memory functions. And this picture here shows what healthy brains look like right here. This brain here is 3 years of meth use at 22. So any areas where that look like there's holes in the brain are just parts of the brain that are not active, where those synapses and fibers did not grow. This is 3 years of cocaine at 22. This is 6 years of inhalants at 21. 3 years of smoking at age 16. And here you look at marijuana. This is 2 years of of marijuana use at age 16. These areas aren't really going to grow back. So it's really important for you to have all the information before you make a choice. And these are pictures of the effects of marijuana. So when you look at this, this is the alveolar bone loss, similar to the same one for cigarettes and tobacco products. All this should be filled in with bone, and it's not. The fiery red gingivitis, see how bright red that is? It's going to be tender. If you brush, it'll bleed. The uveitis, it's so swollen that it's touching the bottom of your tongue, and that would drive me nuts. This is the gingival hyperplasia. You can see here how puffy that is and how it's coming down. It's just excess gum tissue. And this is the leukoplakia on your gums. Something like that. If you see something like that and it's not gone in 2 days, you should have your dentist or your doctor take a look at it and make sure that it is okay. This is a papilloma. Sometimes they look like similar to the HPV papillomas or warts that you see. So if you see something like that, again, and if it's not gone in 2 weeks, definitely have it checked out. And this is cancer on a tongue, what it would look like. And it's the same healthy cadaver lungs and lungs that either tobacco or marijuana would look like. If you or someone you know needs help to stop using drugs, there are many organizations that can help, and here's 3 that you can choose from. And you may be able to get some good information on these sites as well.